Member for Saanich North and the Islands.
Thank you, Mr. Speaker. Through you to the Minister of Health. Does the Minister of Health support a regulated, de-medicalized, safe supply of the illicit substances that are poisoning nearly 6 British Columbians a day?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Because the tragic increased toxicity of illicit street drugs has taken so many lives in British Columbia over the 5 years of the public health emergency, and despite the number of lives lost dropping in 2019 for the first time, and for the first 2 months of 2020, the pandemic has shot drug toxicity so high. As the coroner has noted, this is directly responsible for the terrible increased loss of life. And so 2 weeks into the pandemic, my friend and predecessor, Judy Darcy, along with the support of Dr. Bonnie Henry, brought in a project that they'd already been working on. It needed to be brought in immediately to allow prescribers to connect people who are at risk of overdose with a prescribed safe supply. We've talked about this many times in the House. We had feedback from both people who use drugs and from medical practitioners that people needed more options. That was the basis for the expansion of the prescribed safer supply that Dr. Henry and I announced in July of this year. Thank you.
Member for Saanich North and Islands, supplemental.
Thank you, Mr. Speaker. I didn't ask the Minister of Mental Health and Addictions her opinion on the matter. I asked the Minister of Health. And I understand that the government can stand up whatever minister they want to answer whatever question is asked. However, it's a specific question to a specific minister, so I ask again. Through you, Mr. Speaker, to the Minister of Health. Does the Minister of Health support a regulated, de-medicalized, safe supply of the illicit substances that are poisoning nearly 6 British Columbians a day?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I am honored to be asked by the Premier to be his Minister of Mental Health and Addictions. British Columbia. British Columbia was the first province in Canada to establish a ministry and a minister with a single focus. I'm grateful to the health authorities that deliver both substance use, addictions treatment, and mental health supports. And with the Minister of Health, we are asking a lot as a province of our health authorities right now. They are fighting 2 public health emergencies. They rolled out an unprecedented vaccination campaign in our province's history. And we are asking health authorities to report to 2 ministers, both myself on mental health and addictions, and to the rest of the healthcare file to the Minister of Health. We work well together, and again I'll say we're the only province in Canada to offer people at risk of toxic drug overdose prescribed safe supply. It is saving lives. I wish it was saving more. We're working hard with the health authorities to expand it every day. Thank you.